Namaste everyone. Myself Dr. Swathi. Today here I am going to present a very well-known guggulu kalpana medicine, that is Yogaraja guggulu, which is one of the most commonly prescribed Ayurveda medicine, and it is a very good Shula Prashamana, Shofahara and Stambhara medicine. So now looking into the reference, there are two main references. Those are Bhaishaja Ratnavali in Amavatadikara and Sahasra Yoga in Vatakadi Yogas. So now looking into the reference according to Bhaishaja Ratnavali, the shloka goes like this. Chitrakam pippalimulam yavanikaravi tatha vidanganyajamodha cha jeerakam suradaru cha chavyela saindhavam kushtam rasna gokshuradhanyakam triphala mustakam vyosham tvakkushiram yavagrajam तालिक्षपत्रं पत्रं च श्लक्ष्णचूर्णानि कारयेत् यावन्येतानि चूर्णानि तावन्मात्रस्तु गुग्गुलं सम्मर्ध्य सर्पिषा गाढं स्निग्धे भाण्डे निधापयेत् अतो मात्रां प्रयुञ्जीत यथेष्टाहारवानपि योगराज इति ख्यातो योगोऽयममृतोपमः आमवाताड्यवातादीन् कृमिदुष्टव्रणानि च प्लीहगुल्मोदरानाः दुर्नामानि विनाशयेत् अग्निं च कुरुते दीप्तं तेजोवृद्धिं बलं तथा वातारोगान् जयत्येष सन्धिमज्जगतानपि. So according to this shloka, the ingredients include Pipalimula, Chavya Chitraka, Vidanga, Jiraka, Ajamoda, Trikatu, Triphala, Yavani, Ushira, Yavakshara, Karavi, that is Krishna Jiraka, Devadaru, Ela, Saindava, Kushta, Rasna, Gokshura, Dhanyaka, Musta, Tvak, Talisapatra, Tejapatra, Gukulu, Krita. Here, all the drugs need to be taken in one part each, whereas Gugulu should be taken in 23 parts and Ghrita should be quantity sufficient. So, all these drugs should be made into Sukshma Churna and show that the Gugulu should be taken in the Kalva Yantra. Uh, so, to this, a little quantity of Ghrita should be added and it should be pounded well till it attains a proper paka, and the sukshma churna which is already prepared should be added to this little by little and it should be mixed homogeneously by grinding till it attains a pill-like consistency. Then gutikas are prepared, dried and stored. Looking into the Sahasra Yoga reference, most of the drugs are similar to that of Bhaishaja Ratnavali, but there are few more drugs being mentioned. Those are Lavanga, Sarjikshara, Shati, Danti, Guduchi, Hapusha, Ashwagandha, and Shatavari. So now here looking into the indications, according to Vaishaja Ratnavali, the indications goes like this. That is Amavata Adyavataadin Krimidashravranani cha Pliha Gulmodharanaha Durnamani Vinashayet Agnincha Kurute Deeptam Tejo Vriddim Balam Tatha Vatarogan Jayattesha Sandhimajjagatanapi. So, according to Sahasra Yoga, there are few more indications been mentioned. Those are Padagraham Kroshtakashirsham, Manyastambam Hanugraham, Karnagraham Karnashulam, Shirashulam Marutkrutam. Looking at the properties of this Yogaraja Gugulu, it has Tikta Katu Kashaya Rasa, Laguruksha Guna, Ushna Virya, Katu Vipaka, Tridoshagna, mainly Vata Kafashamaka. It does Vatanulomana, Medohara, and it is also Balya. So, looking into the effect on Agni, it does Deepana and also Amapachana, and it is also Shrotoshodaka. And looking into the Anupana, according to Sahasra Yoga, it is mentioned as Rasnakvata. It can also be given with other Anupanas like Rasna Saptaka Kvata, which is also Kafahara and Amavatahara. Maharasnadikvata or Gugulatiktakvata or Dashamularishta. And the Anupana can be decided based on the Pradhana symptom present in the patient. So, coming to the mode of action of Yogaraja Gugulu, here most of the drugs are of Ushnavirya, Katuvipaka, and Lagurukshaguna, and it has Deepanapachana properties. Ushna helps to reduce Kapha dosha. So, this can be given in Kapha Pradhana conditions. So, it helps to reduce pain with numbness, stiffness in Amavata condition. So, looking into the indications in Phalashruti, it is mainly mentioned as Amavata and Adyavata. So, it can be given in patients where the patient is having more of Kafaja Nidhana and who are more prone to get Amavata. So, looking into the site of action, every formulation acts on specific sites. So, this acts on Sandhi Majja as it is mentioned in Shloka as Sandhi Majja Gatanapi. So, this should be used in conditions which involves Sandhi and Majja. And coming to the contraindications, it is better to avoid in pain along with burning sensation and dhatukshaya, where pitta and vata dosha are involved respectively, as it may further worsen the condition. If given for longer duration due to its tikshnata, it may increase pitta symptoms, so may prone to UTI or burning micturition. So here are few research updates of Yogaraja Kukulu. So it has been proved that it is anti-arthritic, antioxidant, and also it has anti-inflammatory actions. So if we look into the difference between Yogaraja Gugulu and Mahayogaraja Gugulu, as we see when the word mentioned Maha, when we see in different formulations like Maha Rasnadi Kashaya or Mahayogaraja Gugulu, there will be presence of any Brahmana Dravyas. So, for example, in Maharasnadi Kashaya, there is Shatavari Ashwagandha, which is having Brahmana actions. Similarly, in Mahayogaraja Gugulu, there is Abravasma, Vangabhasma, and Lohabhasma, which is having a Rasayana and a Brahmana action. So, Mahayogaraj Gugulu, it is Brahmana, Rasayana, and can be prescribed for longer term in chronic Kafaja Amavata condition, which is associated with Dhaktakshaya, where Rasayana is needed along with Ushna. So, Yogaraja Gugulu does it is Kafavatahara, whereas Mahayogaraja Gugulu is Vatakafahara. Yogaraja Gugulu is Ushna Ruksha, whereas Mahayogaraja Gugulu is Ushna Snigdha. In Amavata, in Kevalavata stage, Mahayogaraja Gugulu can be given, whereas in acute onset, where there is Kafaja Nidana, where there is symmetrical joint pains or morning stiffness, in such conditions, Yogaraja Gugulu should be given. So, this is brief explanation about the formulation Yogaraja Gugulu. Thank you.